I'd like to thank everybody for coming out today. My name is Dave Zegan, and I'm the AHS Edmonton Zone Medical Director. On behalf of Alberta Health Services and the Stollery Children's Hospital, it's my pleasure to welcome you here today to celebrate what truly is an exciting day. First, I'd like to acknowledge that we are located on Treaty 6 territory and respect the histories, languages, and cultures of First Nations, Métis, Inuit, and First Peoples of Canada, whose presence continues to enrich our vibrant community. I'd like to thank the Honourable Shandro, Minister of Health, for joining us to help us make this announcement today. I'd also like to welcome, representing the AHS Executive Leadership Team, Dr. Mark Joffe, Vice President and Medical Director with Alberta Health Services. And also joining us, Mike House, President and CEO of the Stollery Children's Hospital Foundation, a partners whose community donors have long supported children and families during their healthcare journey. So much of what we are able to do here is thanks to the Stollery Children's Hospital Foundation and its many donors, some of which are here today. So welcome and thank you all for being here. In all we do at AHS, we are committed to patient and family-centered care. Any opportunity we have to closely look at how we can improve the care is a good thing for Albertans. Today marks the start of one of those opportunities. I would like to invite the Honourable Tyler Shandro, Minister of Health, to the podium to tell us a little bit more.
Thank you very much. Good morning, everyone, and thank you for joining us. Thank you so much to AHS leaders and staff for hosting us outside the Stollery Children's Hospital, located just behind me inside the U of A hospital. Let me begin by saying that every day, many families and children rely on the Stollery Hospital and its amazing staff to help their sick kids. For all of the parents here and who are watching, we all know the terrible, empty feeling that comes with having a child who needs emergency medical services. And this children's hospital is a lifeline, and it's a lifesaver. Every year, 300,000 patients walk through the doors, including 55,000 who visit the emergency. And lots of local kids come to the Stollery emergency for broken bones, bumps on their head, respiratory issues and asthma. And these are all scary things for them, and scary things for their moms and their dads. And many others come from far away as well to access specialty services. The Stollery is the only pediatric trauma center for Northern Alberta, and it serves kids from Northern BC and Northern Saskatchewan, as well as the territories. And families rely on the Stollery as Western Canada's leading pediatric hospital for heart surgeries and organ transplantation. It's the main children's hospital west of Toronto that handles the most complex and the most serious medical cases. And the medical teams and experts from the hospital perform more than 500 heart surgeries here every year, plus heart and liver transplants, brain surgery, or scoliosis surgery. And the list goes on with all the amazing specialized medical work and care that's offered within these walls for our youngest patients. And in fact, the Stollery Children's Hospital is one of the largest catchment areas of any hospital in North America, serving patients from an area that's larger than the area of France, larger than Texas. And that's a lot of care, it's a lot of comfort, a lot of vital health services to keep our kids and our families as safe and healthy as possible. And yet the Stollery is a hospital within another hospital. Unlike Calgary or Vancouver, Edmonton doesn't have a freestanding children's hospital. And so that's why today I'm excited to announce that Alberta's government is committing up to $1 million to explore a new standalone Stollery Children's Hospital. And with a matching $1 million from the Stollery Children's Hospital Foundation, we will immediately start the capital planning process. AHS, Alberta Health Services, will first develop a needs assessment. And that assessment will help us to determine if children and families would be better served by a bigger, better, brighter children's hospital dedicated to and set apart for children. Today brings an amazing opportunity to imagine and to envision what a new standalone children's hospital can mean for babies, for young people, and for their families. So imagine a state-of-the-art facility that offers complex and acute emergency, medical and surgical care for kids, as well as mental health services for children and adolescents, all under one roof. And imagine a center of excellence dedicated solely to children and families, a benchmark for other children's hospitals around the world. It could be a visual symbol and a reminder that the health of our children is our priority. They're the future of our young province, and like with all new infrastructure projects, we will make sure that this new facility would be planned and built around the needs of patients and families. And so I look forward to seeing this exploratory work get underway and to thank the Stollery Children's Foundation and all of the generous donors for committing to this forward-thinking and bold project. We can dare to dream and see where it takes us as a province. So thank you very much. I also want to thank our colleague, Minister Madhu, who really wanted to be able to join us today on the line, but unfortunately wasn't able to join us. So thank you to him as well for his support of this project. I'll now ask Dr. Joffe, who's the Vice President and Medical Director for Alberta Health Services, to be able to say a few words about this exciting project. Dr. Joffe.
Thank you, Minister, and good morning. What a great day. It's my pleasure to be here with you today, gathered on Treaty 6 and Métis Region 4 territory, a traditional meeting place and home for many Indigenous people. I would like to offer greetings on behalf of Dr. Verna Yu, President and CEO of Alberta Health Services, who would very much have liked to have been here this morning, but unfortunately could not be. We are very excited about today's announcement because it's an announcement about opportunity. Exploring the potential for a new standalone Stollery Children's Hospital gives us the opportunity to take a close look at the healthcare journey of our patients and families. It gives us an opportunity to look at what we're doing well. But more importantly, it gives us an opportunity to look at what we can do better. Our patients come from far beyond our city's borders, more than 300,000 patient visits per year. The Stollery Children's Hospital provides care for children from central and northern Alberta, but also from northern British Columbia, the Prairie Provinces, and all three territories. Many families come from very small communities where the entire population is smaller than the number of people who work in this hospital. It can be a challenge to navigate the healthcare system, and physically navigating a large building can be intimidating as well. We need to do everything we can to make that journey as smooth and as possible for patients and for families. It's part of Alberta Health Services' commitment to patient and family-centered care. We have world-class teams and some of the most advanced equipment available. We are truly the best at what we do in many areas. The Minister mentioned this, but we lead the way in cardiac care and pediatric organ transplants in Western Canada. By taking a closer look at the needs of patients and families and the physical space, we can ensure that we are doing all that we can to offer world-class care in the best possible physical environment. Moving forward with these next steps is incredibly exciting and truly encouraging. I'm an infectious diseases specialist, and a small part of my training was actually in pediatrics. Working with children and families, I understand the special attention needed by children and their families within our healthcare system. Not only because managing the health of a child will have direct impact on their health for years to come, but also because having a sick or injured child has an immense impact on parents and families. Anything that we can do to help families and reduce those stressors is valuable and much appreciated. We are so fortunate to have the Stollery Children's Hospital Foundation by our side. Their donor contributions help us to improve care and provide comfort for patients and families during what is often a very difficult time in their lives. We are truly grateful for the funding commitments from the foundation and from the government to get this exploration project underway. This commitment gives us the opportunity to help give children a lifetime of opportunities. I would now like to call on Mike House, President and CEO of the Stollery Children's Hospital Foundation. Thank you.
Thank you, Dr. Joffe. Thank you so much. Hope that's okay, everybody, so you can see my face a little bit. Well, first of all, thank you, Minister, for being here. It's a great thrill to be able to be part of this announcement and to just say thank you again for your leadership and for championing everything that you do for kids, not just in Edmonton, but all across this province. And I also want to say a special thanks to MLA Jordan Walker, who is representing Sherwood Park, and he's here. He's one of the behind-the-scenes champions for kids in Sherwood Park and all throughout the province. We have several trustees that are here today whom I'd also like to recognize. Our board chair, Noah Jones, is here, as well as Delphine Brooker, Jeff Bryson, Dr. Sarah Forgy, Kevin George, Dr. Karina Majasic, Kevin McKee, Christine Westerland, and Dr. Lonnie Zwagenbaum. Thank you all for being here. This is amazing that we have such support from our board here. On behalf of our foundation and our board of trustees, I want to start by saying just how excited we are for what this partnership means for kids who are sick or injured and for their families. I'd like to thank Minister Shandro, as I said, for championing this endeavor, and truly it does mean the world to us. Today is a great day because we're embarking on a journey to work hand in hand with the Government of Alberta and Alberta Health Services in the pursuit of a new hospital for kids. The $1 million that our donors contribute towards a feasibility study will help Alberta Health Services and the Government of Alberta in this first planning step for a modern, purpose-built, standalone children's hospital, one that is designed to provide the best physical and mental health care. We're really, really lucky to have some of the best care anywhere for kids at the Stollery, but unfortunately, as our population has grown and infrastructure has aged, the hospital has become limited by its space. Now, the current hospital, which is interspersed with the adult University Alberta Hospital, was actually built for fewer patients and for simpler challenges. It was designed in the 1970s, and the building has been outpaced by 21st century technology, 21st century medicine that is used to support patients, but also to support their families and family-centered care. With more than 300,000 patient visits a year, which is 2 in 5 of those patients coming from outside of Edmonton, from as far away as the Yukon and Nunavut, the pressure on the Stollery only grows with each passing year. A new, reimagined hospital in a space all to itself will provide the infrastructure we need to advance our vision, which is to give kids the best chance anywhere to live a long and healthy life, and to create a network of care throughout this province. We hear from families all the time about how fortunate they feel to have the Stollery in their own backyard, and we hear it from the public too. Our recent donor survey shows that 95% of respondents in Northern Alberta think the Foundation's support of a new children's hospital is vital to the health of their community. And 87% of them said that we should be working closer with the government to improve care for children. If we find that a new, purpose-built, standalone hospital treating kids, both mentally and physically, can be built, the Stollery Children's Hospital Foundation will be working even more closely with the Government of Alberta and Alberta Health Services to build this new children's hospital. I just want to say a special thanks to the donors who are here. You are playing a vital role today in building world-class care in our own backyards that exists at the Stollery, and the potential to do even more to support a new children's hospital. It can't be understated. And I just off script, I have to say, I see Dr. Keith Aronik, who has been at the Stollery for, I'm not going to age you, but for a very, very long time. He had dark hair when he started. And I think about him and all the work and all the children that he has served throughout the course of his career, and I'm so excited for them. They're all adults now, but it's still great to have you here, Dr. Aronik. We have a once-in-a-lifetime opportunity to get this right for kids who require urgent, acute medical care, both physically and mentally, for their families and for generations to come. We're so proud to be here today to represent Stollery families and donors. Thank you for dreaming big. Thank you for dreaming big on behalf of kids all across Alberta. Thanks very much.
Thank you, Mike. Thanks so much. Thank you so much. Thank you for being here. And Mike, just before we take questions, just to thank you, your staff, your board, your donors once again. This is a conversation that began with the advocacy of the foundation, and so thank you to you and your board and your staff. So thank you.
So we'll now begin the Q&A portion. If you are here in person, please come join the queue in front of that microphone. And operator, can you please put through our first caller?
Mark Delaney, CTV.
Hi there. This is a question for Dr. Zigan and Dr. Joffe. I'm just wondering if either of you were consulted on the plan that quarantine would no longer universally legally be required for close contacts of confirmed cases, as well as the plan for August 16th, no masking on transit taxis, no masks in schools, basically all restrictions lifted. Just wondering what the consultation process was like and if you were endorsed on that plan.
Thank you for the question. I would say that we were aware of the discussions that were ongoing. The discussions occurred primarily within the public health teams, both within Alberta Health and within Alberta Health Services. So the public health teams were certainly involved, engaged, and consulted along the way.
I don't know, Dr. Zigan, has that answered, or if you want to come up, and maybe I'll also just supplement that. Just a reminder that the office of the Chief Medical Officer of Health, Dr. Hinshaw, has about 16 folks in her office, including the Deputy Chief MOH and other folks in public health, and they're located in the ministry in Alberta Health, but Alberta Health Services, where most of our MOHs work, including the senior MOH, Dr. McDougall. And so my understanding is, as that work was done by Dr. Hinshaw's office to come forward with this proposal, was done in consultation with those public health folks in the MOHs in AHS. Dr. Zigan, I don't know if you want to. Okay, thank you.
Did you have a follow-up, Mark? Okay, and we'll.
Just wondering what made the province, I guess, think it would be a good idea to make this decision. It is a very drastic decision to make no masks on transit, no masks in schools. What prompted such a drastic decision? I know a lot of people are concerned. A lot of infectious disease experts are very concerned about this plan. How do you mitigate some of those concerns?
Well, I think that's why for a couple of months now and many weeks that both we and Dr. Hinshaw have been talking about the transition from a pandemic response to an endemic response. And as we see our vaccination numbers rise in first doses and second doses, how we make that transition and our response to the pandemic and moving to the endemic phase. If we remember back in March of 2020, this is also something that Dr. Hinshaw spoke about even back at the beginning of the pandemic response, that the three stages of any pandemic begins with containment, and then we move to mitigation, and then it moves to the endemic response, where we live with a virus in our community. And this is now a virus that, as Dr. Hinshaw has said, is treatable by vaccines, or preventable, I should say, preventable by vaccines. And for her, and the work that her office did to develop the milestone of 65% in second dose coverage to moving to that recovery phase, that endemic phase in our response, was out of the work that she had done. So, and I think, as we've seen for the last 16 months, that yes, we have many different opinions in the medical community, and that's to be expected, and that's encouraged. But our Chief Medical Officer of Health and the amazing work that her and her office have done throughout this last 16 months, I think deserves the deference that it deserves, and her independence, I think the amazing work that she and the MOHs throughout AHS have done on this pandemic response are to be commended, and I thank her for that work. For this work and moving to an endemic response, I'll leave, maybe further comment for her, but I think, we did know that this is, when we do move to an endemic response more clearly in some of these measures, that Some folks were going to have questions, but I think that's why we're trying to do it in a thoughtful way, in a staged approach, based on really important metrics and milestones that were developed that are based on the science and based on the data. Thank you.
Okay, and we'll take our next question from the floor. Go ahead, sir.
Charles Rusnell with CBC. Minister Shandro, what was the impetus for this decision to go to the endemic stage? Did it come from Dr. Hinshaw and her staff, or did it come from you?
Came from Dr. Hinshaw. It was work that, as I said, I've already answered that. I'm happy to repeat the answer, that this is work that was developed by those who are in public health. I know that folks that last 16 months have throughout the world tried to use a lot of opportunities to undermine the credibility and independence of medical officers of health throughout the world, and that's been particularly the case here in Alberta. I think it's unfortunate. I think it was irresponsible over the last 16 months for folks to have done that to Dr. Hinshaw, but I think that her work throughout this pandemic response is to be commended, and for this work to come forward from her office. Obviously, we will continue to support the work that she does on a resource level, but also to be able to support making sure that AHS has the resources that it needs as well to continue to protect lives and livelihoods. Follow up? Sorry, you have to get closer to the microphone.
How will you assure parents that their children going to school unmasked will be safe? I mean, you made much of the fact that the Stollery is about keeping children, the safety and health of children. There are many people who think that this is an unsafe move. So what is in the works to ensure that these children will be kept safe when they return to school?
Well, again, I think it's the deference and the independence and the credibility of our Chief Medical Officer of Health and the work that she does. So, again, she's the Chief Medical Officer of Health. I think maybe that might be a better question for her as a physician herself, and I'm not a physician. But this is a plan that is based on the science and based on the data. We know that throughout the last 16 months that there are folks that have had anxieties on, both ends of the political spectrum, who have had difficulty in believing the work that's been done in this pandemic response that's been based on the data and based on the science. We know that people will continue to have that anxiety, but this is work that was done by public health based on the science and based on the data.
Operator, could you please put through our next caller?
Dave Pizer, 660 News.
Hi, good morning. Question for the minister. I've got one relating to the topic and another regarding COVID. I'll start with the latter. A lot of university profs here are now calling on making vaccines mandatory as the Delta variant remains a threat, especially for those who can't get vaccinated. And some post-secondary institutions in Ontario have made it a requirement for students living in residence there. I'm wondering whether or not that's something that your government's discussing, and if we may see students, specifically in post-secondary, getting vaccinated as a requirement.
Sure, thanks. So I think I got most of the question. There was some traffic went by that made me lose a couple words. But if this is about mandatory vaccinations done by other organizations, I think it's very clear in the Health Information Act that somebody's personal health information is their own personal health information. If people decide to disclose that personal health information, including whether or not they've been vaccinated, is up to that Albertan. For somebody to compel that disclosure, I would have concerns. I guess there are certain situations. For example, if an employer decides to only hire somebody if they have been able to prove to the employer that they have received one or more doses of the vaccine, I leave that for I guess employment situations to figure out those type of answers. But for the post-secondaries, I'll leave that in particular for Minister Nicolaides to be able to answer. But I mean, generally, my take is that it's we all have a record once we've received a vaccine. We get a paper record. We also have access to our personal health information through my health records. But I would have concerns if there are opportunities for people to I guess compel that disclosure of someone's personal health information. Do you have a follow-up, Safe?
I do, just regarding the hospital, actually, wondering what the timeline is regarding looking into whether or not having that standalone children's hospital, where the money's coming from, and if it did move forward, would it be solely funded by the province, or would there be a private entity involved in it as well?
Well, I think I don't want to speak for the foundation, but there might be opportunities for us to partner in some opportunities for them to raise money, perhaps for after this planning phase. But this is a commitment from government and the foundation for $1 million each for the planning process. I don't think I can commit to this time. That might be a question for Minister, or I don't know, for AHS maybe. I don't know, Dr. Joffe, if you know if there's any timeline for when the planning process will be completed. But after we have that needs assessment by AHS, I think then we'll be able to know what the timelines would be. I know it's frustrating for some folks to know the health infrastructure does take time for it to proceed through all the different K checks, but those different processes are important for us to make sure that when something is developed and built in this province for health infrastructure, that it is done on time and on budget. So we'll see by the end of this needs assessment what the next steps will be, and how what the amounts would be that would be required from Treasury Board, and how it'll be funded.
Okay, and back to the floor for our next set of questions.
Hi, Carl Lafayette with CTV. Question for you, Minister Shandro. When it comes to the fall and having our past experience this past fall with the measures that were in place and seeing how we virtually eliminated influenza with those measures, I'm just wondering if this government has learned from that and can apply some of those measures to this fall with what works so well with now, as it seems like this government is sort of incorporating a response to COVID into all viral infections in general. What can be learned and what can be applied?
Just so I understand, with the goal of having no viral infections in the province?
Well, no, I understand that can't be the goal for this fall. That's not realistic. But there was success with those measures with other viral infections last fall. Can you take any of those lessons to make this fall better beyond COVID?
Well, if we remember, and let's go back to even yesterday and Dr. Hinshaw's remarks at a press conference, this was a new virus these were questions that everybody throughout the world had to answer, because it was a new virus we didn't know much about. We knew that it was deadlier and more infectious than other viruses, including influenza, and that meant having to take some very strong measures throughout 2020 and 21 to be able to protect lives and protect livelihoods. And those, now that we see that this is a virus that is preventable by vaccines, our focus again was on the stress and the pressures of the health system. So now, as we see 95% of those who have died since, I can't remember the date, but if I go back to Dr. Hinchill's remarks yesterday, are those who are unvaccinated. And 94% who have been hospitalized are unvaccinated. This shows that the pressures on the health system and our concerns about protecting lives are changing and moving to an endemic response. But for other viruses, Dr. Hinshaw, is excited to being able to move back to other important files on her desk. She does a lot of important work, including the other 16 people in her office. And I think they are, excited to go back to other public health issues, and as well as the other MOHs throughout the province. So whether there's more for us to be learning, I know that we're going to have to update our pandemic plan as a result of this pandemic, as we did after H1N1. We're going to continue to monitor the situation now that we had very little, as you said, transmission of other viruses throughout 2020. We know that throughout the summer there is going to be an uptick in viral infections throughout the province, and we'll have to monitor that closely. But I don't know. I hope that was answering your question, but perhaps any further than that might be directed to Dr. Hinshaw.
As a follow-up, then, the endemic has been repeated many times already this morning. What message does that send, though, to that last bit of people who, as a province, we're trying to convince to get vaccinated, but when the messaging is endemic, does that not seem to suggest that at this point we're through it, we're good, you don't need to get vaccinated?
No, you definitely still have to get vaccinated if you haven't. This is, and just look at the numbers. Those, thankfully, the pressures on our health system are alleviated by these vaccines. But if you look at the folks who are in a hospital right now from COVID, they are, by and large, folks who are unvaccinated. and folks who are dying. I mean, it was only a couple of days ago, there was a 30-year-old woman who was in Central Zone who had no comorbidities and unvaccinated who passed, unfortunately, due to this horrible disease as a result of the virus. So the message is for people to continue to get vaccines, and Albertans are going to be assessing their risks. If they can't get a vaccine, they will have to continue to assess their risks in the community and which situations they're in, if they are in close contact with people, their workplace, public transportation. But we will, as the rest of the world is going to as well, move to the endemic stage in the response of this virus. Thanks.
Operator, could you please put through our next caller?
Imbert, CTV.
Hey, yeah, this one for the minister. I just want to go back to school, the school topic. Obviously, some parents already raising concerns about that return in September. I just want to know from you, what's your message to those parents who are concerned about September and to those parents who have children under 12 and who aren't eligible to be vaccinated?
Well, again, going back to what Dr. Hinshaw has said about the dangers of the virus when it comes to those who are under the age of 12. For those who are in a family where there are others who are vulnerable to a severe outcome, who might live in the same household of a child who is under 12, understanding then that this is, I guess, another reason for those families to make sure that folks who are eligible for the vaccine continue to get that vaccine. But Dr. Hinshaw has also made the point throughout the previous school year, when you look at the transmissions in school, the transmissions were commensurate with the amount of transmission we saw in the community. So we didn't see the significant concerns of transmission in the schools. She is going to continue to monitor the situation in our schools. But again, this is speaking to the independence and the credibility of the work that she and the 16 folks in her office are doing, and for us to continue to make these decisions based on the science and based on the data.
My follow-up.
Sure.
You mentioned the science, you mentioned the data. I just want to know where does that science, where does the data have to go before we say, as far as schools are concerned, where does that science and data have to go before we say maybe we should start reintroducing masks or physical distancing or what have you in schools? Is there a number, or is just going to be kind of played by ear?
Well, I mean, it's going back to looking at and continue to monitor the severe outcomes for those who are under, who are not eligible yet, those who are under 12, and we don't see those types of concerns for those who are not eligible this time for the vaccines, and when it comes to severe outcomes. So if that ever was the case, then of course I'm sure Dr. Hinshaw would bring forward that data for us to look at, so we can continue to focus on our response to this virus being one that is focused on the data, focused on pressures on the healthcare system and protecting lives. So we don't see that at this time. She doesn't see that at this time. And we'll continue to monitor the situation in schools and in other situations throughout the province. Thank you.
And back to the floor.
Morgan Black from Global News. Thanks for taking my question. So Alberta is deviating from the rest of Canada with these health measures, and there seems to be a disconnect between the new measures and what many Alberta healthcare professionals are saying. Dr. Hinshaw said it was difficult yesterday to point toward other jurisdictions that have done similar things because of our high vaccine rate. So where did the government draw the data from for this plan?
Well, the milestones that were picked by Dr. Hinshaw, maybe that would be a question better for her. And if it's a question specifically on what the data was that she used to bring forward this proposal and shifting. But these, Dr. Hinshaw has the last 60 months had close conversations with the Special Advisory Committee. Now, this is a committee that's made up by the other chief MOHs throughout the provinces and territories. She has had close conversations with other chief MOHs. I would say that I understand that other chief MOHs know throughout the world as well that this is going to be, because we all know that there are 3 stages in a pandemic, and the third and final stage is a population living with that virus and moving to that endemic response. So I think people are aware that it is inevitable that every jurisdiction is going to be going there. The reasons why the United States has some testing centers that are coming down, but they don't have the widespread proposal that's similar to this because their vaccines. There's so many states that don't have the uptake in vaccines. The ones that have very low coverage in vaccines are the ones that are seeing concerns with the Delta variant right now, and it's related. It's proportional to them not having anywhere near the second dose coverage that we have. So it was Dr. Hinshaw who, with her data, looking at previous viruses and previous pandemics and coming up with a number of 65% second dose coverage for that milestone to be chosen based on that data. So it is also looking at other pandemics. We also know, looking at other countries as well, you're right, when we look at countries that, by the time that this was being developed, we were looking at Australia, but they had 23% first dose coverage and 4% second dose coverage at that time. So there was a huge difference between us and Australia. They did really have significant problems with the rollout of their vaccines. The United Kingdom relying almost entirely on AstraZeneca, and because of that, not providing vaccines to those who are under 40 for a very long period of time, and that was the concern for the Delta variant. So those are jurisdictions that make it difficult for us to use as a comparison, but that allows us Dr. Henshaw, to be able to look at other viruses and other pandemics.
So for follow-up, obviously a big incentive of getting the vaccine is to not get sick, but for some individuals, kind of, the mandatory isolation, things like that, was also a big impact on their life. Is there concern that removing those measures is going to create less of an incentive for those individuals who are eligible but have not yet received the vaccine to just simply not take that step if getting sick was never enough for them to choose so?
To answer this, it's not avoiding the question, but it is answering the question. But for me to answer it, maybe if I just go back and remind people that the way that we judge the efficacy of a vaccine is different ways. We can judge it on the individual level, and we look at severe outcomes. And so we can look at a population, say those who are over 75 and those who ended up in a hospital or unfortunately dying from COVID. And then we can see after the vaccine how effective it was in reducing those severe outcomes. The other ways, like the population, the way we judge a vaccine from asymptomatic infection and from transmission has been very difficult. But we've always known that there could still be asymptomatic infection and transmission. But our focus on the measures that we've had for the last 16 months in this pandemic and a response to the pandemic has always been on the pressures of the healthcare system and to trying to protect lives. So that's looking at the severe outcomes piece. So it is true that we know that there will continue to be some transmission, but the data shows that what the vaccines are doing is making it less infectious and less deadly. And that's a good thing that allows us to be able to move to that endemic response. Thank you.
So this will be our last set of questions. Operator, could you please put through the final caller?
James Keller, Globe and Mail.
Hi, a question for the minister. No other place in Canada has ended widespread testing, contact tracing, or isolation as Alberta is now preparing to do. And Dr. Hinshaw could not name another jurisdiction anywhere that has done this. So when you talk about the need to base this on science and evidence, what makes you so comfortable that this is a good idea when there are no examples to point to show that this works?
Sure. James, happy to answer the question again. As I said, this was because those were other countries that didn't have the same coverage in first and second doses that we in Canada did have. So that did mean having to look at responses to other pandemics and the effectiveness of vaccines in being able to pick certain milestones like 65% in second dose coverage to be able to move to a recovery phase or a endemic response to the pandemic. That is where we were able to look and where Dr. Hinshaw. But look, I think as well, just again, Dr. Hinshaw does stay in close contact. I think other provinces know that this is going to be, the inevitable next step in Canada for all provinces. We are leading the way in moving to the endemic response. Like we've led the way throughout the response to the pandemic. Quite frankly, it was Alberta that beginning in January of 2020, thanks to the great work of JP, our Lord Beaverbrook of the pandemic, and being able to make sure that we had the PPE throughout 2020 and 21. enough that we were able to donate to other provinces. For us to make sure that we had the surgical capacity throughout our hospitals, that we were able to even take ICU patients from other provinces during this pandemic. We have led the response in many ways. Sometimes folks didn't even follow our lead, like being so pro-mask in this province that we even gave out 40 million masks in this province. But I think this is going to be a situation where we are leading the way again in the response to the pandemic, and there will other provinces will inevitably have to be moving to this step as well. Thanks, James. Yeah, of course. Did James get a follow-up?
Do you have a follow-up question, Mr. Keller?
Yeah,
Just before we go to that, Charles.
I do, yeah. So I know that Dr. Hinshaw made the same point, that fewer places, you can't point to other jurisdictions because other places don't have the high vaccination rates we do. But again, like every province in Canada, a dozen U.S. states, Israel, the UK, other countries, all have higher vaccination rates than Alberta. So, Alberta really is an outlier here in terms of its response. And I'm just wondering how you can sort of assure people here and people across the country that this isn't going to backfire when, again, very clear that Alberta is sort of off on its own here.
Sure. Well, again, pointing out that this isn't the first pandemic that the world has responded to. This isn't the first pandemic that we've seen in Alberta. There's the 16 folks in Dr. Hinshaw's office, as well as the MOHs throughout AHS, have extraordinary amount of experience in public health and in responses to other pandemics, and when it comes to infectious disease and the effectiveness of vaccines and being able to prevent the severe outcomes. So I again just point out to that experience that our MOHs throughout the province have, including Dr. Hinshaw. Thank you, James. And yeah, no, sure, Charles. Follow-up question. Can we turn on his mic?
Will you be sending your own children to school unmasked?
Yeah. My children both go to public school. One of them is still in elementary. The other is in a junior high. And no, I mean, because I am deferential to the independence and credibility of Dr. Hinshaw and her work. And absolutely, I will be. Thank you, Charles.
Thank you, everyone, for taking the time to be here today. If you have any more questions, my contact information is on the news release, and I will be happy to deal with that for you. Thank you again, everyone, and have a great day.
Thank you.